Depression is a terrible illness. Statistics suggest that in Japan the incidence is about 3%, but in this country, the United States, the prevalence of depression is about 17%, or roughly 1 out of 5 people. It's estimated that your betting odds within the next 5 years, if you're a guy, of being depressed is somewhere between 3 to 5%, and if you are a woman, from 8 to 10%. Now, statistics are one thing, but what my patients tell me about depression is entirely different. What my patients tell me is that depression is like being in the pit. My patients have told me it's like a black hole. One of my patients told me that it's not that he was really suicidal, but he just liked to take a gun and in his words, blow all the bad thoughts right outside of his head. He didn't want to be dead, he just wanted to be free of everything that was tormenting him. Now, unfortunately, as a psychiatrist that's been in practice since 1993, I have not yet been able to get all of my patients well. There are some patients for whom drugs simply are not the answer, and indeed there are some patients for whom electroconvulsive therapy or shock treatments, as terrible as they can be, are also not the answer. You know, and I'm going to tell you about this equipment here in a second. But in psychiatry, up until recently, it was thought that ECT was it, that it was 80% effective, and if people were not better with medication, that electroconvulsive therapy or shock treatment could bring them out of the pit. Well, in 2008, as a result of a great deal of research and some very interesting folks that have gone before, the FDA approved this device, the Starr TMS system, for preliminary use. And then in 2011, they approved it as a Class II medical device, specifically for the treatment of depression. And the FDA labeling, or the way they say that this machine can and should be used, is for those people who are suffering from depression and have failed one treatment with a suitable antidepressant drug. Now, the problem for many people is that they go from drug to drug to drug, and the drugs simply don't work. And there's a trial, a clinical trial called the Starr trial that basically talks about the law of diminishing returns. And if you fail one drug, your chances of responding to the next, I believe, are 37%. When you fail the next drug, your chances of responding go down. When you fail the next, it gets worse, and when you fail the next, it gets worse. And so the more drugs that you're exposed to, basically it looks like the less likely you're going to be to get results. So this is where the Starr TMS system comes into practice at Cady Wellness Institute, and I want to tell you a little bit about it. This is, in my opinion, the most effective, safest, most well-tolerated treatment for depression that there is. It is not like electroconvulsive therapy where patients have seizures and have to be knocked out and rendered unconscious. It does not involve medication. It involves magnetism. So let me tell you about the way it works. First of all, in order to do that, I just happen to have a brain along, so let me get my brain. Here we go. So here on this brain, we have localized, or scientists have localized, where things live. And this is the central sulcus. And this strip, or this gyrus, this little bumpy, ridgy thing, is the motor strip. And we know where things are on the motor strip. So what we do when we are administering a TMS treatment is we find where on the motor strip we can make the right thumb twitch. Now, this is the left side of the brain, and the motor and sensory tracts cross down deep in the brain, so the left side of the brain makes the right thumb twitch. And so we will administer a magnetic pulse on the left side of the brain, which causes the right thumb to twitch. We will find the minimum amount of magnetic pulse energy required to do that, and that is the so-called motor threshold. And then we move, and I will show you how it works in a second, we move the head of the TMS device 5.5 centimeters forward or anterior to what's called the dorsolateral prefrontal cortex. Now that's fancy medical speak for it's on this side of the brain, and it's a little bit back, and it's on the prefrontal cortex, and it's up on the top, and it's, you know, right there. It's an area about the size of a golf ball, and what we want to do is we want to make sure that this magnetic pulse head is centered right over that area. So it's very convenient that it's the same height on the brain as the neurons to make the thumb twitch, because we can just go straight ahead 5.5 centimeters and we will be over it. So let me put this brain down, and then I'll show you how the chair works. Now when a patient comes in for their first treatment, that's where we're going to determine the motor threshold and figure out kind of where we're going to arrange things. So this is a very comfortable chair. It's actually a German spa quality chair. I've sat in it. I've actually had about a 6.5 minute session of TMS because I wanted to know how it felt like. The chair is very comfortable and the procedure is easily tolerated. This head rest right here goes up and down, and it goes back and forth. You can see that. And there are settings here on the side of the head support where we can read out, and you can't see it from there, but we can actually read out the angle that this guide bar is set at, and we can go forward and back, and this is called the AP bar, and there are markings right here in centimeters, so we can go hunting for the motor threshold, and then when we find it, we go 5.5 centimeters forward, and that's where we treat. Now the cool thing is there are all kinds of numbers here, so once we do it the first time, we lock those into the computer settings on the machine, and then it's very easy for the patient. So let me show you what happens. So the patient comes in, sits in the chair. Usually we have this arm up. They sit down, swing their feet over. We make sure that all metal objects are removed from their mouths. If they have tongue piercings, those have got to go. And then the chair comes up like this, very gently. We always tell the patient before we raise them up in the chair. And then it will lean back. And here it leans back automatically, and the feet come up like so. And then this is where we move. This is actually called a gantry, like the rocket gantries. We move the treatment coil into position. By the way, I will mention in passing, this device right here is a Starr. This is one of the things that unfortunately makes the treatment somewhat expensive. You'll notice two little blue dots here. These are sensors. Actually, I'll show you all of it. And you'll see right in here there are some electrical contact strips which mesh with these. So what happens is, I'll put it back in, what happens is as the treatment is administered, there are sensors in here that count every magnetic pulse that goes through into the patient's head, and these two little buttons right here make sure that the Starr and the head unit are in touch with the patient's head. Now I really haven't told you how this works yet, so I just want to have you reflect for a second on, if you have it, an electronic toothbrush. Many people have these, and if you think about it, there are no contacts, and you just plug it into this charging base in your bathroom, and magically overnight the battery gets juice and it's charged. What that is is using Michael Faraday's principle of electromagnetic induction, which he actually published in 1831. And simply stated, it's as a magnetic field crosses a wire, it sets up a flow of current in the wire. That is exactly how this works. This is a 1.5 Tesla, that's a unit of magnetism, and that's a lot of magnetism. 1.5 Tesla coil. And it's actually arranged pretty interestingly. You can't see it because it's in here, in a figure 8 configuration, and you'll notice that this is curved. And what that does is it focuses the magnetic energy straight into the brain so it can get as deep as possible before the magnetic current, or the magnetic pulse fades. So what happens is, as the patient is lying back and we have determined where their motor threshold is and we have moved the treatment head 5.5 centimeters forward, we will push it down on their head and then we will let go right here. And this is an electronic brake. This noise that you keep hearing is the brake. So we let the brake go and we lock it in place, and that is where the patient is treated. Now, the standard protocol that was used, which elicited FDA approval, was 3,000 pulses, rapidly administered, about 10 pulses per second. Sounds like pop, 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 like that when it's going. 3,000 pulses administered into the left side of the brain, the left dorsolateral prefrontal cortex. And it takes about 37 minutes for standard settings for those pulses to be administered. And after that, the treatment's over. The treatments are done Monday through Friday, 5 days a week, for 6 weeks in a row, for 30 sessions. That was the protocol that these two studies used, that won FDA approval. Now, the first study looked at patients that had failed as many as 23 different medications or combinations of medications. So this was like the creme de la creme of the depressed crowd. These people were really sick. Nothing had worked. And remarkably, in this patient population, 1 out of 3 went into remission. That's like happy camper land. That's where the depression goes away. And fully 1 out of 2 responded. In the second treatment, the rates weren't that good initially. It was about 1 out of 8, 15% went into remission. But as these patients were continued in treatment, then 1 out of 3 in that group went into remission as well. Now, those are pretty good odds if you're one of those patients that have gone through multiple medications, one after the other, and they haven't worked. But I will tell you that there's a difference between how those studies were done and what we do here at Cady Wellness Institute. And while it's on my mind, let me just give you a website that you can jot down and go to. It's www.wisdomlinkradio.com/listen. wisdomlinkradio.com/listen. There is an extensive audio interview that I recorded there which explains really what we do differently. So let me tell you about the apples to oranges kind of comparison between what happened with the FDA clinical trials and what we do here. First of all, it is important to understand that when experimental trials are being given to the FDA, what the FDA wants to see is a clinical response or remission compared to placebo. Now, in order to control for that in these trials, what the company did and what the experimenters did is they wanted to eliminate all possible confounds. So, first of all, because even the personality of the person standing here and treating the patient can impact the patient emotionally, they forbade the treater from talking to the patient. All they could say was, "Good morning, hop in the chair." That was basically it. So no emotional connection or contact, no therapeutic discussion. They could read a magazine or watch TV, but they were not doing anything therapeutically. Secondly, all of the patient's medications were stopped before the treatments began. Everything was washed out. So you could be grievously depressed on multiple medications that maybe were helping you a little bit, but you just have that cut out from underneath you in these clinical trials. That's really good for science, but it's not good for clinical medicine and clinical psychiatry. So what we do in our TMS program here at Cady Wellness Institute is, if a patient is partially better on the medications, we leave it be, and we start the treatments on those medications. In addition, because we practice an integrative model of psychiatry here, we pay particular attention to other things that can confound the problem and make the depression worse. This includes practically any hormonal system that can go wrong in the body. Your thyroid gland, your adrenal glands, the little walnut glands on top of your kidneys, walnut-shaped glands on top of your kidneys, your sex glands, your testicles, your ability to produce testosterone if you're a guy, or in a woman, your ability to produce testosterone from your ovaries, as well as estrogen from your ovaries. So we have actually had people that have come in, their thyroid has been out of whack, their adrenals have been out of whack, their sex hormones have been out of whack, and they've even been anemic. So we've ended up rebalancing their hormones, getting them on iron for their anemia, all while they're having their TMS treatment. So that's actually what I would consider pedal to the metal biological psychiatry, maximal intervention, maximum potency to get the patient better. That's the biological aspect. In addition, we focus on the psychological and the behavioral. And those are really the only three things that you can do in psychiatry. You can give somebody a medication or administer a treatment like this, a biological treatment. You can do talk therapy with them, psychotherapy, and you can do behavioral therapy. So I just happen to have another visual aid that I brought along. And this is a particularly beautiful example of behavioral therapy. This is a painting that was done by one of our patients during his TMS treatment. It is called Sky of Hope. And there's an interesting story about this painting. This young man had not painted since he was in high school, and now he's, I know his age, but I won't say it exactly. He's somewhere in his early 30s. And he was totally regressed, not doing anything. We brought him in. He'd failed every medication. We had him on TMS. We were cranking along. He wasn't getting better. And so I began asking him one day when I was in here with the treater, what are some of the hobbies that you've enjoyed? He said, well, I used to paint. I said, really? So the first thing we had him do was bring in some of his paintings. And we actually had 3 paintings of his, or actually 2 of them, along the wall right here. Every time he came in, he looked at his paintings. Then I told him, I want you to go get a canvas and some supplies. That was his assignment. Canvas and supplies, nothing else. He got it. Then I told him, I don't care what you do, I want you to make some kind of mark on that canvas. Doesn't have to be great art, just do something. So the first thing he did was he painted a yellow line right across the middle of it, and you can see that yellow line. And then I said, keep going. And I hadn't seen it. The only thing I saw was this white canvas and a yellow line across the middle. And he continued working on it. I said, come on, let's get it done. I want to see something. And so really in a matter of a few days, he brought this final painting in, and I asked him if I could buy it from him as an example, because I mean it's good artwork. It's from him. It's his personal, emotional, artistic experience. He said, no, I'm giving it to you. I want you to have it. So we have it right here in the TMS room. I frequently use it as an example to patients that yes, they can get better, and it's really a beautiful remembrance of this patient who continues to work on his recovery. So let me put this aside. So we talked about what basically your betting odds were of getting better if you went through the pre-clinical, pre-release trials of TMS. Your betting odds were 1 out of 3 of going totally into remission and 1 out of 2 in terms of responding. We've run slightly over 20 patients through our program. It is a somewhat expensive procedure. It is something that most of the time people do when everything else has been tried and it has failed. But I will tell you this, even though it is an expensive procedure, the people that this has helped and have gotten well have told me, and we have their video testimonials, and some of them are on our YouTube channel. They have told me that they would have paid any amount of money to get well. One guy said, I would have paid 10 times what it cost. Even if it had bankrupted me, at least I would have been happy. And when you are in the pit, or your loved one is in the pit, bad things happen. You have no hope. You have no expectation that things will improve in the future. You got no energy. Your concentration may be frazzled. There are multiple symptoms of depression, and perhaps I'll give another educational lecture on the depression as well on our YouTube channel so that folks can watch it. But what I want you to know is, in our program, as opposed to the clinical, really good science but not so great therapeutic aspects of the clinical trials, in our program, for those people that really are specifically depressed, they fulfill the diagnostic criteria for which this treatment was FDA approved. When we look at how many of them remit or respond, our betting odds are about 2 out of 3 that are going into remission. And the reason is, we don't just put them in a chair and don't talk to them. My treating staff, and there are 2 lovely ladies that treat our patients, Jackie or Marilyn, they're very warm and fuzzy. They engage the patient. We have a CWI neurocognitive biobehavioral matrix that we use, which integrates the biological, the psychological, and the behavioral. We use maximum medication. Sometimes I will even add medications or augmentation strategy while the patient is getting TMS. And we will, and I haven't even told you about this yet, sometimes we do what I call hot rodding our TMS machine. Now remember, I told you that the clinical trial was specified 3,000 pulses. This Starr is actually rated for 5,000 pulses, and it is gone after 1 treatment. It goes in the trash can. It cannot be used again. So that means that typically 2,000 pulses that could be used go in the trash. For people that are not yet responding adequately to TMS, we will go ahead and we will give them 4,000 pulses on the left. In one case, I even gave 5,000 pulses to the left side of the brain. This is the rapid pulse. But the other interesting thing is, you can move this cable right here to the other side of the machine, and I can't do it right now because the patient has to come up, but you can move this all the way around to the other side, and you can administer treatments to the right side of the brain as well. And the right side of the brain, at a very slow pulse, like 1 hertz, appears to be very helpful for anxiety and perhaps even obsessive compulsive symptoms. Now I want to make sure that I add that that's not what it's FDA approved for. It is FDA approved for the treatment of depression. The standard protocol is 3,000 pulses rapidly administered on the left side of the brain. But clinicians are using it on the right side of the brain as well. It is described in the peer-reviewed medical literature, and so sometimes we end up totally exhausting this Starr with 3,000 pulses on the left, 2,000 on the right, or 4,000 pulses on the left, 1,000 on the right. Basically, what we want to see in our TMS program here at Cady Wellness Institute is we want to see people get well. And so we will do, whatever we can to make sure that that happens. So it occurs to me as we come to the end of this time together that I've told you all about the magnetic pulses going into the brain. I've told you about the cordless toothbrush model of charging, but I haven't really told you how this works in the brain and why it appears to work so much better than other treatments. What happens is when the pulses are shot into the dorsolateral prefrontal cortex on the left side of the brain, these pulses stimulate the release of neurotransmitters in that area. And particularly serotonin has been identified. That's the one that goes up with Prozac. Most people have heard of Prozac. But in addition, there's something very interesting about what happens with these magnetic pulses. Not only do they cross at a perpendicular angle the neurons there that are at 90 degrees to them and cause current to flow and release serotonin, but they also, these pulses also hit so-called pyramidal cells, which are up in the top layer of the cortex and which have axons or like nerve cables that go deep into the brain and project to deep brain nuclei. When those deep brain nuclei are stimulated because there's already been an action potential generated in the pyramidal cell from the magnetic pulse going across it, when those impulses go down into the deep brain nuclei, that causes those nuclei that have projections all over the brain to release more neurotransmitters. And that's the reason you get such a robust antidepressant effect from TMS. So, we've talked about the treatment, we've talked about how it works. I suppose I haven't told you totally about patient experience. This is an extremely well-tolerated procedure. I will tell you that patients lie back here. It's a whole lot better than having your teeth cleaned. They have smiles on their faces. They're talking to my therapy staff. They're cracking jokes. They're talking about what they've been doing. This is not like the One Flew Over the Cuckoo's Nest, Nurse Ratched, ECT type scenario. This is very well tolerated. It's actually a pleasant experience, most of my patients tell me, and they certainly enjoy the fact that they're getting better. So, I think we've covered it now. We've talked about the machine, how it works, the mechanism of action of treatment. So what should you do with this information? Well, obviously, if you live around here where Cady Wellness Institute is in the Newburgh, Evansville, Indiana area, we'd love to have the opportunity to see you, evaluate you, and if necessary and appropriate, treat you with TMS. It's very easy to get in touch with our office staff. We actually have real live human beings that answer the phone. Our front office number is area code 812-429-0772. Our website is www.cadywellness.com, and our specific TMS site is tms-relief.com. Now, if you're not living around here, I'm pleased to let you know that Neuronetics, which is the company that makes this machine, has on the very first page of its website, down at the bottom, find a TMS center near you. So all you have to do is type in your zip code, hit enter, and you can find one of my colleagues somewhere in this country that has a TMS installation that could treat you. I believe that about wraps it up. I really appreciate your joining us and listening to this presentation on TMS as we do it at Cady Wellness Institute, and I wish you the very best for the future. This is Dr. Lewis Cady at Cady Wellness Institute saying so long for now.